Anxiety common among COVID patients. How does one avoid negative feelings when you are a COVID-19 positive patient? How do you come out of anxiety?
Any problem that one would face in our life, and when it is so unprecedented and mammoth, with so much of potential distress and fear, will give you anxiety, Rajdeep. It's the most human basic reaction. What do? I have been saying this for a while. There is only one thing that can be done, which is don't label it. Don't think that it's a mountain. It's a reaction, a natural reaction. It will pass. Once things settle, more importantly, support systems count. If your support systems, you reach out to them, let them support you. It's just together we can make a difference when it comes to mental health related distress issues. This is not about a disease.
Right.
If you have anxiety because you have COVID or somebody in your family has COVID, and if you are feeling restless, anxious, worried, sleepless, you don't need to pop in a pill. You don't need counseling. You don't need to go to an expert. You talk to a friend. You take care of yourself. Be patient. Let the doctors do their job and wait it out. That's the way to look at it.
So you're saying use your support systems effectively. Let's turn to the next question, Dr. Chhabria. Should COVID patients stay away from news? Some psychiatrists have written a letter saying so. Lots of bad news across TV channels. Should we be staying away from the world of news, not reading newspapers, not watching channels?
When you're going through COVID, I think it's better to stay away from negative news. Okay, you may want to be in touch with the world, but it takes maybe 5 to 10 minutes a day, in the morning or the evening to catch up with the news. There's no point in hearing how many deaths have happened, how many oxygen, or where oxygen was not available, because all that, and if you keep looking at the figures of COVID, in your head, especially because you're alone, you're isolated, you might keep thinking that you will become one of those figures, and the negativity increases. So we have been telling all people going through COVID that keep yourself relaxed because your immunity depends on your emotional health.
Right.
So if your emotional health is in control, you're calm, you're relaxed, you're able to deal with the situation better.
Okay, so you're saying watch news, but please watch it in moderation. Do not watch it in excess, certainly. I want to come to you, Dr. Desai. A main concern today is grief. When you lose someone, survivor's guilt and the thought that I could have done more comes. This is being experienced by a number of people. How do we help ourselves on that front? Are there stages of grief? How do I deal with the grief that people around me have passed away? Could I have done more to save my father, my mother, my friend?
Sure. Like Samir Parikh said, almost all the reactions of anxiety or depression or worry in this phase be considered normal, and so be the grief. The trouble, obviously, as you are saying, is that the grief is too acute. The usual normal feeling that people have while grieving about could I have done more, did I do enough, survival guilt, in this period is much more by reality and by the onslaught of negative reports. And so all that we need to do is really, like Samir said, for all such grief reactions, deal with it as normally as you can. Level 1, depend on oneself. Level 2, depend on friends and family. Level 3, try and seek informal support. Only at level 4, seek professional help. But the crucial issue here, Rajdeep, is also this. While I agree with Samir, I'm sure we'll all agree that in grief or in depression and reaction, we need to normalize the experience, absolutely. At the same time, be sensitive to those who require professional help and do that identification early.
Okay.
The most difficult part for neighborhoods or for families or for individuals in this phase is to walk that dual line. Consider all anxiety, grief, depression as normal for majority of us, and yet be able to identify and help those people who require professional help and do so early. So the indicators of that, if there are any suicidal thoughts or preoccupation with death, if there is gross problem of sleep or appetite, if there is excessive crying, if there is excessive worrying, as seen by self or others. So some of the indicators would be useful to differentiate those who require help early.
You know,